So we're going to do the countdown, and then I'll start off with introductions. And if you could introduce yourselves, is that okay? All right. 5, 4. Order, and a very warm welcome back to Manchester Town Hall. We're still here, but this time we are hearing from witnesses in connection with our pensioner poverty inquiry. And thank you so much, all of you, for coming along today from across Greater Manchester, but also from Leeds. Perhaps if I could start at the end, and if you could introduce yourself.
Oh, hi. My name's Paul McGarry. I'm head of the Greater Manchester Ageing Hub, which is based in GMCA, which is a unique partnership of policymakers, academics, community organisations, private sector organisations, behind the mission of creating an age-friendly city region.
Thank you.
Hi, I'm Jo Volpe. I'm Chief Exec at Leeds Older People's Forum. We're a membership organisation for third sector organisations who work with and for older people in Leeds, and our ambition is to give older people the choice and control to live the lives that they want to live.
Hi, my name's Jo Rowlands. I'm Head of Financial Inclusion at Leeds City Council.
Good morning. My name's Lauren McKechnie. I'm the Chief Executive at Age UK Bolton and the Chair of our Age Well Partnership in Bolton as well.
Good morning. I'm Trish Martin. I'm the Advice Services Manager at Southway Housing Trust, so representing housing associations.
Fantastic. And again, thank you so much, all of you, for coming along today. I'm going to kick off questions, if that's okay, and then we've each got a set of questions for you. And I was struck by the evidence that you submitted to the committee for this pensioner poverty inquiry in terms of the evidence you say in terms of the number of pensioners that are struggling financially. I wonder if you can expand on that in a bit more detail in terms of particularly who you've identified and in what ways that they are struggling.
Thank you very much. For us, particularly in Bolton, but we know that this is the same picture across the piece. Our pensioners who are living with disability, women, our private renters, those from our black and minority ethnic communities. Particularly for us in Bolton, there really is 3 subsections that we've found that are the most challenged, and that is our pensioners with disability, our private renters, and those just above the pension credit threshold. And you'll appreciate there's also an intersection between each of those subsects as well. In terms of our disabled pensioners, we know that the entitlements that they are able to access are just insufficient. So even the monies that come in, though people are in receipt of benefits, that does not alleviate the experience of poverty. And so that's a very difficult thing for us to overcome there. In terms of private renters, as you'll appreciate, the market by no means has kept up with the local housing allowance. We're finding that in Bolton, the local housing allowance, we're looking at £463 per month. In terms of the average 1-bed flat on private rented is anywhere from £700 to £800 in Bolton. So you're talking of 40, nearly 50% differentiation there in terms of costs. And for those just above the pension credit threshold, again, we see it time and time again that for those that are eligible for pension credit, that does passport people to a wider variety of different benefits and entitlements. However, for those that either are missed, are not identified and connected to their entitlement, or those that are just above the threshold for that, it's an incredibly polarising situation. It really is genuinely feast or famine there. And the impact that we're seeing across all of 3 of those, I know it sounds very remiss to say, but it literally means the difference between life and death for people in Bolton. In terms of what we are finding people are experiencing, the struggle to the cost of heating, of food, of travel, social isolation. We talk about finance sometimes in a very isolated manner, but the absolute truth is if you cannot pay for things, you cannot obtain those things and have those life experiences. Without being too too academic about it, I suppose. We look at our hierarchy of needs, or Maslow's hierarchy of needs, and the reality is we're experiencing Bolton, but again across the piece, those absolutely fundamental needs for people to not thrive but survive, we are not able to secure for people at the moment. With our energy costs, we absolutely find that our specialist staff are going into living situations with people who are literally living in one room. They are living with no access to food. They are living with all of their clothing, literally all of their clothing.
So does that mean if they've got, in terms of lack of access to food, they're malnourished?
They're malnourished, absolutely. So we find that there is a very strong correlation between financial poverty for pensioners and the prevalence of malnutrition and dehydration. And linked to that, we know that to save money, people are reducing their access or their services round about alarm systems. And so people are falling more, not getting the care they need. The impact of their falling is more severe. And so it really is a self-fulfilling prophecy that we're experiencing.
Okay. Jo?
Just to reiterate that what we find in Leeds is that people who are living in poverty, we are seeing greater frailty. So when I would to look at the figures for falls, 63% of unplanned admissions this year in terms of people who have fallen or had an injury from falling.
And how does that compare to, say, previous years?
Well, I'm not sure how it compares to previous years, but 63% of those that are admitted are from IMD1. Okay. So we are seeing the higher percentage of fallers from people who are living in poverty. Yeah. And I think the other category of people that I wanted to say that we're seeing experiencing poverty are unpaid carers. Yeah. So we have an annual survey of unpaid carers, and there's around 35% of those are actually having to go into overdraft or borrow money from families and friends. So that isn't sustainable.
No, is it increasing debt something that you're
increasing debt? And I'm happy to look at the figures in terms of falls in comparison to previous years.
Yeah, so I mean, one of the questions that we wanted to try and pick up on whether because of the change in winter fuel payment and the eligibility of winter fuel payment, whether that had been noticed, so whether there had been an increase in hospital admissions and so on. We were in Glasgow yesterday, and the point that Lauren mentioned about living in one room, that was very much resonated to what this older people's group was telling us then. Not switching on heating. Are there other examples like this in terms of how this manifests and people really, really struggling? It means you don't go out because you can't afford to go out.
Yeah, sorry, that's exactly what we're finding through the evidence that we get through our health partners and through other third sector organisations, that it does impact things like simply even like transport to hospital appointments, which is obviously necessary, loneliness and isolation. I think we've had people say, it feels like we're back in the pandemic where, previously we'd be able to go out and maybe have a coffee with friends or look after grandchildren or go and spend time, then that's been impacted. Across the board, I think we'd just like to reiterate what's already been said. I mean, it is important to point out that this is a continuation of a situation that's been sort of apparent for a long time. Yes, we have a cost of living crisis, but we have evidence in Leeds prior to the pandemic that people were already struggling to meet basic living costs and were no worse prepared for a financial shock or crisis than they had been 10 years previously. So it's just getting worse.
Yeah, and Trish, in terms of arrears in rental payments, is that something that you've noticed?
Not particularly, because they really try and pay the rent before anything else. When we find somebody that is struggling, it's usually the income team might notify us, or our age-friendly team will see somebody and forward it along to us. But we really find that people at pension age pay the rent first before anything, so they're not. So we don't really notice.
Okay. Paul, I wondered if... Yes, of course. Yeah.
I mean, just on the point that the examples that we've heard, I wrote my first ageing plan for the Manchester City Council in 1997.
Yeah.
Okay, I think before New Labour were elected, and many of the issues that have just been raised as examples were examples then. Issues around pension poverty, transport, housing, access to health services and so on. Now we know that there have been changes in national policy that have affected some of those things over the last 25 years, but for a certain part of our ageing population, a certain group of our older population who generally live in low-income communities, these things have remained issues in their lives for a long time. And on the issue of frailty and falls, there is some evidence that the impact from around about 2008, 9, 10 and onwards is that the health status of that kind of midlife group have got higher levels of frailty than the group immediately older than them. Okay, at the same stage. Yeah. That was research done by our colleagues here at Manchester University based on data from the English Longitudinal Study of Ageing.
Have you sent that to us?
I'm not sure, but we can. Yeah, there's a report called Golden Generations issued about 5 years ago. So these issues are new, but they're not new, I think is the point. And I think what's critical in all this is that there is no strategy or accountability on ageing society. There was an ageing strategy up until about 2010 and 11, and for the last 15 years, there's been no governmental accountability into local authorities, mayoral authorities, and other authorities around the ageing society. Which, when you think about the fundamental change it's going to make in how we all live over the next generation, it's a huge gap. Now, other countries are doing, Singapore, Australia, Norway, are all dealing with this. But it seems to me that the number one thing that will make a difference to all these conversations is there needs to be a government-wide strategy on the ageing of our population. That seems to be the number one thing.
Thank you.
Sorry.
No, that's really helpful to be honest. And I was going to say, in your evidence, I think you submitted, you say that exploring government targets to tackle poverty and promote greater independence in later life should be part of that. I mean, is that right? You want to add to that?
It is, and so pension poverty is nothing new. It's gone up and it's gone down. It's changed. Yeah. There's a narrative, obviously, which is very persuasive, that older people are okay at the moment, in general, compared to younger people, which isn't borne out by the facts. And actually, it's about social class and ethnicity and gender and so on, which are the defining issues rather than age. And certainly our experience is that when you place accountability, and I know this from having experience being a local government bureaucrat under a number of different governments, when there's some accountability in the system, then local authorities and others bring forward resources and focus on that issue. When there is no accountability in the system at a national level, as the Mayor said before, one of the great things about the work that we do in GMCA is we can kind of decide what we do on these issues. So the work that we've done over the last decade in GM and before that in the City Council here was really work that we decided to do ourselves because we saw the gap at a national level in policy making. So it's kind of bewildering on one level that we have this fundamental shift going on in our population, but nothing really said at a national level, and in some cases makes the situation worse. I'll just say one of the things that we could do something about pension poverty is put more of a focus on older workers. Okay, so the number of people between 50 and state pension age out of work and looking for work is, in some cases, as large as it is amongst younger groups as well. Yeah. And it seems to me that our colleagues in DWP have done a lot of research with us, designed programmes jointly with us, need to do more nationally to talk about and to get employers to sign up to taking on older workers. Because if you're out of work when you're 50, the chances of being poor when you're 65 are significant.
Absolutely, and prevent them from becoming out of work as well.
Sure.
Lovely. I'm going to hand over to Damien Egan.
Thank you. I've got some questions about the Household Support Fund. And to just look at examples in your areas about how it's been used, because obviously there's flexibility there, and how it's been used to support pensioners this winter.
So the approach that we've taken in Leeds has been collaborative. We've worked across council services and across our third sector. We've sort of broke it into three key areas. One, direct funding, so where we are able to identify as a local authority that people on a low income, we're able to give cash payments, so via our council tax support caseload, including pensioners. Over the last winter, because of the removal of the winter fuel payment, what we did there was we identified people on council tax support who weren't eligible for the winter fuel payment and gave them an additional amount, and that's happened over the last time. We've distributed funding via our own council services, so housing, children's, public health, so where public health are identifying or health services are identifying people with a clinical need are able to refer into energy support, for example, and then around 25% of the funding has gone out through the third sector. So we've done a mixed approach, we've adapted it year on year or every 6 months depending on what's needed. And it's been a real lifeline for people and for organisations, and it's enabled, I think one of the key things that it enables that in services and the third sector being able to engage with people in really difficult situations, and we are seeing complexity of cases and issues across the board increasing. It enables, even if it can't solve the problem, it enables engagement, and it enables sort of a slow move into support where it is available. So that's how we've been using it primarily in Leeds.
Should I just add about the third sector distribution? So Leeds City Council involved Voluntary Action Leeds, Forum Central, which is a partnership between Leeds Older People's Forum and another third sector infrastructure organisation, and the Food Aid Network. And between us, we identify community organisations who have got real reach into grassroots, at a grassroots level, into communities and the people that need that support. So at Forum Central, I've managed the grant programme there, and we open a grant programme for 3 weeks, and we're absolutely inundated with applications to enable community organisations to buy food and fuel vouchers, and we funded 62 organisations on the last round, and 28% of that funding went to either pensioners or people with a disability. The highest number went to households with children.
Just to add to both Jo and Jo's points there, we took a similar approach in Bolton. Funding for the VCSE sector came via our local infrastructure organisation, Bolton CVS, and very much that collaborative approach. So in Bolton we do pride ourselves, as with other places as well, of not working in isolation and providing that entry point for individuals. I think sometimes we forget about the degree of dignity and pride and control for people as they are living in poverty and facing these fundamental challenges of survival. And actually for their, as Jo was saying, those grassroots organisations, those street level hyper-local organisations are the ones that they affiliate with. They are the people that in their street that they know, that they have relationships with, that they trust. And so actually engaging with those organisations for support, it really can't be understated how important that is for people. And so in Bolton, we've really capitalised on that, for want of a better word, in that even by Age UK Bolton's point of view, we can seem quite intimidating. We have our own barriers for engagement there sometimes for people. And so if we work with those hyper-local groups that have that rapport, that have that trust and that connectivity, it also passports people into that, as Jo was saying, more holistic support for people in the imminent and the longer term as well, as and when they need it.
Just a couple of things from me. So Manchester City Council and Salford Council have used this fund for kind of one-off payments for residents not in receipt of pension credits, or just above the pension credit cut-off. And they've done that through kind of trusted voluntary sector organisations. And the City of Manchester allocated, I think it was around about £1 million to pensioners in lieu of the the reduction in the winter fuel payments as well. So you'll see across the region the way that it's been used by a number of them in a kind of targeted way or in a more general way. But again, the way of doing that includes and involves a layer of bureaucracy and includes requires capacity and expertise and links into local communities, which is a plus, but it also then creates work for those organisations to do when they might be doing some other things as well. So they kind of that needs to be more systematic. It needs to be more part and parcel and business as usual of what we do, I think, to get those resources out to people.
And GMCA's taken more of this cash-first approach. What was the thinking behind that?
Well, I think for us, it was the most effective way of getting resources out to people quickly. I think throughout all of our work, and we've run 3 or 4 campaigns around pension credit, but not just pension credit, attendance allowance. A lot of the campaigns have actually raised money in other areas, such as people underclaiming state pension, housing benefit, and a range of other entitlements. It's actually you need to be able to do these things quickly, and you need to be able to respond quickly. And what we've been able to do across the 10 authorities with ourselves, and again, this, I suppose, builds on what you've heard from the Mayor in terms of the Live Well work, is that we're able to do things quickly because we built up relationships over time with partners at a city, regional level, at a local authority level, but right into communities as well. So we have a great relationship with probably hundreds of community organisations, and one of the challenges for those of us who work in these systems is to be able to draw a line between the decisions and the programmes and campaigns that we design jointly with older people right into the living rooms of older residents, that they feel that there's a relationship between the things that we do. And that's about building trust and showing impact quickly, I think. And one of the negative things I would say about the whole experience is that we should have done this earlier. And actually, I remember running these campaigns in the 90s, well, in the 2000s as well. And actually, for a long time, there were no genuine national campaigns to do any of this work. And because of that issue of accountability that I mentioned before, very few local authorities, I think, made this work kind of routine. And where they did, there were some great examples in Manchester here and in Salford. We had very experienced council employees running these programmes. They kind of melted away a little bit between 2010 and onwards. So, yeah.
So, a final question, because we've got different uses of the Household Support Fund. If you were to think of examples in relation to older people where you've seen it work particularly successfully, can you share some of those examples and any awareness about how the Household Support Fund is evaluated as well?
I guess for Leeds, I think, because we have such well-established local networks across the city, it makes sense that we fund those networks. And one of the things that we've used the funding for is what we now call welcome spaces, as opposed to warm spaces in what they were what they were when we first established them. And that's where community-based, very locally based community organisations open their doors, and then people can just come, have a drink, have a chat. There's no expectation on them. And I think that works well because it links in, it does, like I said, very slowly links into sort of other support and advice, makes people feel comfortable. And these are well-established networks, and so then they can link into other types of social activities that are going on, so that works well. I think it is just about using what's already there and then amplifying that across the board, really.
I can give an example of a gentleman that was referred into sort of that grass level community support. So this particular gentleman was identified by his postman because he was always sat in his porch with his coat on because that was the warmest place in his house. So the postman knew that there was a local community group who were then able to get food and fuel vouchers to the gentleman and then link him into sort of ongoing support and getting mechanisms for him to be able to cope in the long term. But I think just the fact that, you know, a postman sees someone always sitting in the front of the house with the coat on, it's not where we want to be, is it? So it's about a community wrapping around an individual and making sure that that individual is supported and gets what they deserve and are entitled to.
We had a similar example in Bolton of a gentleman that actually attended a grassroots community group with his grandson. His grandson's in his 20s, and it's a group that particularly supports people with drug and alcohol misuse and recovery. And the granddad was turning up more and more at these sessions. So he went from attending the walking football to being the umpire at the five-a-sides to being the tea and coffee guy at the knit and natter event. And that was a bit of the red flag, actually, to that group itself. And the reality was that the gentleman couldn't afford to stay in his house. It was better for him to be out, one, engaging in community, so it was offsetting the social isolation. But the actual motivation for it was that by going to this group and serving other people with the warm tea and coffee, he himself got some warmth and some connectivity. It was through the Household Support Fund that he then was in receipt of some white goods for himself, which helped at home. But it was then passported, referred essentially to Age UK Bolton. We were able to do a whole assessment of his current financial situation. Had he not been identified within that grassroots group, albeit proxy to his grandson's engagement there, then that connectivity wouldn't have happened, and he would have been one of many lost within that system or blind to that system.
At Southway Housing, with the Household Support Fund, when they announced that they were giving it out to people that didn't get the Warm Homes payment, we promoted it, put it out to all our tenants, and we had quite a lot of take-up of the people that weren't on pension credit that actually applied for it, and it was a really easy way to do it as well. It was just one simple form and line. We found it very easy. With regards to what my colleagues have been speaking about, we started a warm space, which has become a welcome space. And it's actually in our head office where a lot of people of pension age are coming now, and they see it as it's every Monday, we call it Cosy Mondays. And then they can get help with advice, they can get help with the rent, they can, we even have a link in with a local company where they've been donating rugs to us, which we've been giving out to tenants and anyone in the local community. And this is free. These rugs were going to landfill, brand new rugs, brand new rugs, all sizes. And now we have a regular delivery from them, and people from all over have heard about it and come to pick a rug up. And this is another way of keeping warm, because we find a lot of our properties, people can't afford to carpet them. So if they can have a rug, that gives them something. Yeah. And that's been really successful, and it's been free. So if you approach local businesses, there is things out there we can get for free.
I just want to build on that last point. Southway Housing have been a partner of ours for many years, and they take a very active role in building community infrastructure, capacity, building relationships with their tenants and other groups. They've done some brilliant work on creating what we call age-friendly neighbourhoods and communities, which are built around the needs and desires of older people. Leeds have done, as much as it pains me to say, Leeds have done some brilliant work over 20 years or so on the Leeds neighbourhood networks. And we've done something similar here with our various programmes, and it's all about building community capacity, particularly in low-income neighbourhoods for older people. They just need places to hang out, places to go. There was a great report, I think, under New Labour again, social exclusion unit, a short start to later life. There was a report by Professor Chris Phillipson on social exclusion in later life. So many of these things are known. The research has been done. In terms of public policy, a lot of that work, I think, has already been done. It's a question of how do we implement it. A lot of this doesn't take a lot of resources. I think it just means that it needs to be integrated. If we're building other programs, whether it's a Live Well centres and even children and young people centres, why can't they be multi-generational instead of just building for one part of the community? So I think it's putting an edging lens on all these policies rather than saying we need huge investment and so on. And I think the examples you've given are those where we've used existing stuff and existing levers in the community to address the issues that we're talking about today.
Thank you very much. Joanna Baxter.
Morning. Thank you for coming this morning. So the Household Support Fund's funded until the end of March 2026, and I think you've quite articulately explained the importance of it. Can you perhaps talk a little bit more about what the impact might be if that funding's not continued?
I think one of the key things there is that opportunity to work across systems and the interconnectivity of organisations. So if that funding is not there, as much as it is an in real-time gesture to someone, as you'll appreciate, doesn't necessarily fix the deep-lying problems. It does provide that opportunity to give someone real-time support, which in itself builds trust and builds rapport. For people, for our pensioners that are experiencing poverty, again, as you'll appreciate, this isn't necessarily a new thing for them. They have engaged with different systems, different institutions throughout life, or perhaps towards later life, and they have felt failed, they have felt unseen, they have felt unheard. And so what the Household Support Fund has allowed us to do is give tangible support and resource in real time, which does build that narrative, build that support, and as Jo mentioned earlier, it opens that door to that wider, holistic, longer term, allows us to really scratch beneath the surface with that person and hopefully connect them to that longer term support that they need that is going to further address the root problems.
Yeah, just to reiterate that, I mean, for Leeds, it was 14.2 million, it's now 12.5 million, and that would be taken out of budgets. Obviously, there is no way of replacing that. I mean, it is providing those very essentials, feeding people, heating homes, allowing them to stay in their tenancies, providing advice, working towards sort of like helping them be active be part of society. It would be, in Leeds, particular significant impact on third sector. And also the way that we're able to support people that are coming through for housing, for example, people that are coming through our health services as well. So it would have significant and detrimental impact.
I guess the concern I would want to raise is if we don't have it and we're not able to do that community wraparound support, people will turn up somewhere and most likely into sort of more acute, more expensive medical environments. So it feels like a preventative sticking plaster, which when you take off hurts. So I that's my concern, is if we lose capacity and opportunity to wrap around the community, around people, they will turn up somewhere, more likely A&E or primary care.
So the LGA called for local welfare support to be put on a more sustainable footing. What do you think is needed in terms of the amounts, the timeframes and distribution mechanisms?
I think longer term, 3 years minimum. We used to do it now, but we found out at the beginning of March how much money we're getting to start today. So, that doesn't really help. I mentioned the amount of funding that we've had each year, but that equates to about £70 million in leads if we'd had a longer term approach. I mean, we do welcome the fact that there is now more focus on prevention as well, so agree that the focus should still be on crisis, but also with prevention as well. And actually, when we look at our programme, we'd built that in anyway, and that was part of what we were doing. So I think longer term, ability to plan, ability to actually sort of work towards prevention would be what we'd be calling for.
Just to build further on Joe's point there, absolutely what Joe said. I think one of the key things for us in terms of that planning is the skill set we have, particularly within the third sector, around about that specialist benefits advice as well. And we know that people need that specialist benefits advice up front first. Otherwise, we are at risk of people, again, falling under the radar or not being able to claim that which they are entitled to. We find that in Bolton, as I'm sure, again, repeated in other places, but part of that can be around form filling. So engaging with an organisation to support form filling, particularly perhaps around about universal credit, that's done with the best of intentions, but actually that's misinformed and it was a different pathway that was appropriate for that individual and they then miss out. With longer term planning, we can work more collaboratively across the system, work closer with our partners to make sure we're all working to strengths across that provision, adding that capacity and retaining the skills and the employment of those specialist advisors who are genuinely specialist in what they do, and we risk losing them all of the time.
Okay. I would agree with that. I've worked in welfare rights for over 25 years. And we're seeing a real lack of really good advice out there because there's a shortage of good advisors who have the specialist knowledge. Within housing associations, we are lucky that we have a team of advisors, which is quite rare, I think, because we have 3-4 welfare rights advisors within our organisation, but that's because South Way recognises the need for it. But I do agree with that. The shortage of good advice is a factor, and if people don't get a good advice, they do not claim the benefits that they're entitled to.
Sorry, just to add to that part as well, and just to give real-time picture of that. At Age UK Bolton, we have one full-time specialist advisor. We have underwritten, so paid for reserves going into this year for another 2 who are already with us. So as it stands, we had no external support for funding round about that, so it's coming out of charity reserves. However, if we were to lose 2/3 of our capacity within that particular area, you can appreciate the knock-on effect that has. So sometimes it does feel, even within ourselves, we're really kind of firefighting to take that preventative approach where we can, or have the capacity to address crisis.
There's just a couple of additional points, I think, here. One is that the investment in, and I absolutely agree, is that we don't have enough expertise or capacity in the system to be able to get people onto the entitlements quickly enough. Okay. And the impact of that is first of all, well, one thing that we're missing out on is that we're getting people onto those entitlements. There is a reduction in cost to health and social care services. I think we've already submitted some evidence from Loughborough University that I think we estimated that just in Greater Manchester that the impact of non-claimants of pension credit is nearly £300 million on the health and social care system. I think the other thing is that the amount of resource that local authorities and their partners can bring into the city and the city region compared to the outlay for older people, compared to the outlay on the staff that are doing this work, is dwarfed as well. But again, it's making the case for that in a marketplace of competing demands in local kind of welfare and other economies. You know, the evidence is really clear that you put a small amount of investment into this work, you get a huge amount of impacts. So I think that message has to be clear as well to our colleagues.
Okay, thank you.
Thank you, Chair. So we've talked quite a lot already about joint working between organisations, and I just want to throw that out a bit wider, really, and talk about other frontline workers, so people who are having face-to-face interactions every day in health or in housing, for example. And I wondered what work had been done to raise awareness of those people and how they know where to signpost. So we spoke about the importance of qualified and experienced welfare support. So have you done work in your area to engage those organisations, and are there some positive outcomes that you can outline for us?
Yes, we've been working around financial inclusion for 20 years, and our approach has been around, or more than 20 years in Leeds. And our approach has always been around working across partners, and that includes our own council services. So we have lots of different frontline services across the city. We've got our hubs and libraries, we've got healthcare, we've got social care, we've got housing across the board, transport across the board. We work collectively with other organisations. We deliver awareness sessions. We have an approach at a strategic and operational level across the council, which are all partnership boards. And then we develop our own, like I say, training and awareness sessions, so that we're constantly getting the message across that, one, you don't have to be experts in any of those issues, and actually please don't be. Make sure that you're referring into the advice services that are available. There is obviously a slight risk with that about capacity, and it's more than a slight risk, to be honest. It's a big risk. So there is sometimes a bit of a debate that we're raising expectation, and we are, but we also want to make sure that that people know where to go for qualified, free, confidential advice. And I think that's particularly important for the older generation, particularly in terms of, we know that they are targets in terms of scams and frauds and all of that. So we have worked consistently for many years. The focus over the last couple of years has been on cost of living, and specifically, and it's given a renewed focus for that. We use teams within the council and across third sector to get those messages out in as best a way as we possibly can.
Further to that for us in Bolton, on Joe's point there around about capacity, which I know we all feel, it is very much a double-edged sword of awareness raising and then actually being able to tackle that. We organised ourselves in Bolton through Age UK Bolton to hold essentially a bit of a triaging meeting with other partners working across the system every week. We all signed up to the principle of let's work collectively as a collaborative and not as an island, and that actually meant looking at our own service provision, how we run and model those services, to try and make sure we're complementing each other, so that if people are referred into different parts of the system, one, that Monday meeting allows us to know what capacity across the system we are managing, who has, I dare say the word spaces or capacity, but where there is flexibility and where there's particularly space. And also from the point of training that I mentioned earlier about people carrying out that form filling support, for people to feel that no matter what role you have, be it paid or voluntary, across that system provision, you are a vital part of that system, and actually coming together to be part of these triaging capacity meetings each week has been incredibly valuable for that, for people to feel that the role that they play, that we don't need to keep it isolated and act as an island, but actually we're serving the people of Bolton and the older people of Bolton much more valuably by working as a collective. But that's taking a bit of shape-shifting and reorganising to do.
In a way, we replicate that at a GM level. I think for 3 years now, 3 or 4 years, we've had a task group which brings together all the Greater Manchester, or a kind of an alliance of the willing of the Greater Manchester organisations, specifically around this issue of cost of living and older people, and it brings together voluntary sector, statutory and so on, which my colleague Joe Garston has organised, and it's enabled us to be able to bring together the expertise and capacity right across the system. It's also enabled us to run the 3 or 4 annual campaigns we've run. We've produced 300,000, I think it was, magazines that went across all our organisations, people in the ambulance service, pharmacies, GP surgeries, housing organisations could receive what's called a Winterwise, publication. That started during COVID when we knew that older people weren't getting access to printed materials with accurate information. So we put a lot of energy into that. I should say with zero budget as well. So we had to beg, borrow and not quite steal resources. So that's been invaluable in bringing together all the talents really that we have. We've also worked nationally with Independent Age, the charity. I think something like 200 frontline staff have been through a short training course that they do online, again from all the different sectors. If you think about the number of professionals that enter the house or have a face-to-face encounter, if you like, with people in this group, they're significant, everything from the fire service to home help to a GP, so on. So there are lots of opportunities to get these messages into the system, but you have to really fight to do it and to be organised to do it and to have the right tools with the right information, co-produced with older people. Absolutely. The language has to be right and so on. And that's enabled us really then to kind of penetrate into local networks with communities who use different languages and so on. And we knew that in some communities actually written literature, even if it was in other languages, wasn't the way to go. I mean, it was through trusted people. So this is about knowing your system, using the system, and actually it's a system or an ecosystem that can then be used for other things as well. Not just for this campaign, for other campaigns around housing or transport and so on. So it's been a very planned approach to build an ecosystem of agencies and organisations focused on this particular group.
I would say from the housing perspective, we work on the ground and we work with all the local agencies like Energy Works, CAB work with us, we work with the local mosque, to get messages out there to people of different languages. We work with the local health services, and we through our Causing Mondays we get people coming in there to talk to tenants who want to come along and meet them. But we get out in the community with our community centres as well, and arrange people from these organisations to come along and spread their message. With Energy Works, we have a really good partnership that we can get out to anybody, any of our tenants, including older people, that they can get out and do a home visit to assess their needs, but what they need to do with energy. And we also have a relationship with the HACT scheme as well, where we can give out energy vouchers straight off to people. And they can get up to £300 worth of energy vouchers through the HACT scheme. And so we've linked into that as well.
I just wanted to add that I guess it's not enough that we kind of know each other and who to refer to at different times and who to support, because there's a cohort of people who just believe that they'll, make do and mend. And we've just done some research with York St John University around generational pride, because that comes up. But then an advice worker who'd been around a while said, well, people talked about generational pride 30 years ago, but that generation, surely, why is this generation still proud? And I think it's because they kind of look back and watch their parents cope, and they feel some pride in being able to. And it's how do we get that message through that actually this is an entitlement that you deserve. And that research showed that peer-to-peer interaction is going to be really important. So we're looking at going to think about it. It's literally like the research I got last week. So we're going to have to think about how we can use that to sort of change the way that we are and how our campaigns work. And I guess an ask to DWP, whose campaigns look at, family members passing that message on. Our research suggests that people don't want to listen to their family if their family tell them they need some money and this is their entitlement. But if their friend tells them, that message is more likely to land.
We produce some talking points for peer support and family members to try, again, co-produce with older residents about how to have a conversation with a friend or a family member, taking your point, and others. And again, that material is in the system. But you need somebody to drive the system forward and to curate the system and to keep energy in it, because as soon as you relax, the system tends to relax. So I'll take that.
Thank you very much, Chair. Good morning, everyone. Just maybe touching on some of the challenges linked to data. When I was serving in local government, one of the big frustrations and challenges that our Tackling Poverty team experienced was that sort of cross-agency data sharing. So I really just want to ask you, do you think that you have the information that you need in order to support those pensioners in the most need, and what would you say is missing at this stage?
No, but with data comes, I mean, I will just reiterate the point, with data comes, more data comes the need for capacity to be able to do something with that data. So we'll just make that point. But in terms of, so if we look at pension credit at the moment, we've got a broad estimate based on analysing the national figure of the number of people in Leeds who aren't claiming pension credit. We can identify about 15% of those through interrogating our own council tax support data or our own housing benefit data. So there's, a significant number that we estimate that we can't, that we don't know. We don't necessarily, I think if we were to have that data given to us, it'd be helpful, but we'd have to have the capacity to work alongside that to be able to do something with it. I think what would be helpful would be to get that data, even just an anonymised local super output area on Stat Explore, so that if there was capacity at some point that, we would be able to share the hotspots in the cities where, there is a low take-up of pension credit. That would be useful. I think, the onus is on the DWP to use the data that it does have to target more specifically the resource, to encourage people to take up pension credit and other benefits. I think as a local authority and local partners, we would happily assist in that. But I think the point does need to be made that it is for them, the DWP, to lead that. So.
Yep.
I agree with Joe completely. I think the flip side of that coin as well is looking at speaking about my own organisation, the capacity and the resource that goes into trying to scrutinise or chip underneath and understand the data that we do have and what story that tells. So as you'll appreciate, when you're in the third sector, you flip from being the information and advice specialist or service manager or volunteer coordinator all of a sudden to the data analyst and the researcher and the specialist in that field. And so for me, for my team, a lot of time is spent trying to pull together the data sets we can have access to. What stories do they tell? How do we scrutinise it? And then how do we particularly engage with the people that are identified through it? So just as Joe was saying there, that if there was a higher level, broader, more holistic support to that, more intention round about that, it means that we could focus on doing what we do best, and that's providing that support to the people who need it.
Paul, if I can maybe come to you, I know that you have called for legislation and more powers for the mayors in order to do some important work that Andy was outlining earlier on. How do you think that would work in practice, and would there be any sort of barriers or unintended consequences to that? Oh, that's okay. No, just saying, if you would you would think there would be any barriers or unintended consequences to legislate and to give more powers to devolved authorities or to combine mayors, and you know, how would you see that working in practice?
I think I mean on the data issue, I think it's hugely frustrating. The position that many of us are in, and I think there's more that can be done with HMRC, working with DWP, local authorities and others to identify the individuals who are in the position of being able to claim pension credit, attendance allowance and other entitlements. And it involves political will, organisational will and prioritisation. I think it can be done. I think we have evidence it can be done, and there's some work being done by companies to help us do that. So I think it can be achieved, and I think it's value for money. I think there is a role for mayoral and combined authorities to coordinate some of that activity, because frankly it's easy when you've got 10 authorities doing it together rather than one local authority on its own. One of the ironies of doing work around older people is quite often it's lonely work. You're kind of on your own. Sometimes it's one or two people. If you can combine that with others, I think that gives you more chance to share good practice and to share the evidence. We know the work that GLA has done. I think it was 30-odd local authorities with the mayor and others can have an impact. And we also know from Wales, Northern Ireland and some of the other devolved nations' work that if you can combine the expertise at that level, you can have more impact. But it goes back to this point of accountability. I know we don't like to set targets, but I think there needs to be a framework in which we do more on this agenda. And I think the other issue, I'll come back to whether there's any downside to all this. I'm trying to think of it as I'm speaking, really, is that the issue of kind of pension and poverty, it's a part of a broader issue of what I describe as social inclusion or exclusion in later life. So you can have money, but if you can't get to the bus, or the bus doesn't go to where you want to go, or if you live in an area where there are a few social facilities for ageing populations, they're quite often in areas, in inner city areas where there are many young people, such as this city, where actually goods and services and local infrastructure is organised around younger people rather than older people. And there are studies going back 25, 30, perhaps 50 years which describe all this phenomenon. So I think at a regional, city regional, and a national, if you think about Wales and Scotland and Northern Ireland, there is far more we can do on this agenda. The evidence is pretty clear. It needs a little bit of support, and it needs some national leadership. What are the downsides to all this? I'm not sure. I've not heard any yet. I think we've just produced a report. We launched a report last week about how a regional impact, I've got copies here, can have an impact across all these issues. But it is, I think it's a struggle to keep this issue as a priority. I think all of us would agree that we struggle to do that.
So we met with a group of pensioners yesterday in Glasgow, and one of the themes that came out of that is that there is still a reluctance for information to be shared, for older people to provide agencies and charities with some information, and that can be linked to a whole range of reasons, pride, and Joe, you touched on some of that earlier on. So how do you imagine pensioners would view more of their data being shared, and how would you seek to, I suppose, alleviate some of the concerns that pensioners in particular carry around the sharing of such data?
I think what came through from the generational pride research that we did was that people were surprised that they hadn't been told of their entitlement, that somebody must know. Why haven't they told me? So I think that would maybe lead me to think about if data is being used to automatically tell somebody you're entitled to this benefit and therefore it's getting paid from your 67th birthday. I think that would be okay, but obviously I can't speak on the behalf of the whole older population, but that would be my surmising from the research that I've read.
I think that's a really important point that was brought up so we've done quite a localised campaign looking at our own local authority data in terms of take up a pension credit, which has had amazing results. I mean, it's been fairly small scale. We've had around 200 pensions take up, and it's equated to well over £800,000 annually. Yeah. I mean, the largest amount that somebody received was an additional £330 per week. So, I mean, the average is around 80. The impact is significant. And one of the key things, and actually what we did was, because we focused that work around those individuals that are likely to get the highest award, because we've tried all sorts of different approaches in the past. So those that are likely to get the highest award, what was needed is, one, they were told that they were likely eligible. Two, there was then a follow-up with a housing officer or somebody going in, a welfare rights officer going in saying, come on, if you received this letter, there was encouragement. And actually what they did need was encouragement, guidance and support to be able to claim. I don't think the issue of their data was raised. I think it was, and it did require quite a lot of, like I said, continued support to be able to do that. We continue to do that work. That's the work that's being done by our benefits service. It's done by officers that are, expert in that area. It's being done as an aside to the day job, but it's the value in which it's come across is significant.
I just had a similar story from a GM point of view. The group that I mentioned before that coordinates this work, we were able to track virtually in real time the amount of claims that were being made and successful claims that were being made by the partners that attended that meeting. Many of them social housing organisations who have dedicated staff who work on this, such as Southway Housing. And we were able to demonstrate through a relatively limited investment of our time and resources the amount of money that was coming into Greater Manchester, into the pockets of some of the poorest older residents. And when you went in front of senior officials and politicians and you said, this money's coming in at this rate, and this is the amount of money this is the gap between what GM should be getting and what it's getting, people's jaws hit the floor. £500 million is being unclaimed in various entitlements. That money could be coming into our poorest neighbourhoods. So it's telling that story. It's building a narrative as well around all this, which is key. And I think the issue of people being worried about their data, on balance, is a lot less of an issue than the success that we can describe.
Amanda Hack.
So we've got no minutes to answer two questions. So I'm going to be really, really brief on a few key elements. So the government's planned to pull together pension credit and housing benefit as a way to try and increase take-up. I'd be really interested to understand what your view of what those challenges could be, but actually also, conversely, the real opportunity that could provide to the older population.
I'll go. I think one of the key things, if I may reiterate it, is that specialist advice first. So if we get the sequencing correct of almost entry points or where people are getting that specialist advice, if we organise ourselves correctly, that's a real opportunity for us, not just in terms of ensuring people are getting the financial pounds and pence in their pockets and bank accounts, but that holistic support as well. So if we see people at the right time with the right advice, what does that mean for hospital admissions? Sorry, put my teeth in. What does it mean for other parts of our system? And that seems like a real opportunity. with this. So sequencing specialist advice first.
I think there are a number of things that we can do, including this, but I think it's the narrative which is the backdrop to all this work, which is really important for us as a society as a whole. And we have to make the argument that if we invest in these types of services and make these changes, we're helping the poorest and other older people now, but we're actually helping our society as a whole because of the impact it will have on reduced demand on some of our services. And that's not why we just do it, but because people will have better lives. Future generations will have better lives. But this isn't special pleading by a particular group of people. It's actually good for us all in our society. So I think the narrative and the way that we tell this is as important as some of the specific actions that we take and the measures that we implement. Otherwise, we're at risk of fueling division and so on. And I think the last point I would make is that the impact on some of these programmes and measures are in some of the what are described sometimes as left behind communities and neighbourhoods who've really, I think, felt the impact over the last generation or so of feeling disconnected with politics and policy making. And it seems to me that if we can offer hope and help and ambition for older people in some of those left behind, inverted commas, neighbourhoods, then that gives us a chance to engage people on other things because they don't feel that they're being listened to. So I think it's a really important part of broader kind of the body politic that we do some of this work.
Just to follow on from that, as part of this reform, should the government considering actually looking at tapering pension credit and to try and reduce the cliff edge that we have at the moment, but also that threshold of missing out on all the passported benefits?
Yes, I agree. They should taper it because we see a lot of people who just miss out. I mean, I was dealing with a gentleman yesterday who rang. He had no food, needed a food bank voucher. Recently went on to pension in January because he's just over the limit for claiming pension credit. He's really struggling, as you know, because everything else is going up. Had to give him a food bank voucher and we've also given him energy vouchers, and he's so grateful for the help. But someone who's just newly retired shouldn't have to be doing that. You know, he has no savings, but he's struggling already and he's only just started out. But what I would like to see, if we do merge pension credit and housing benefit, is being able to contact the DWP. This is the biggest gripe with my advisors. You can never get in touch. You're hanging on the phone for about an hour and then it goes down. We haven't got time to sit in someone's house for that time trying to communicate with the DWP. We used to have the Apollo list where advisors could register and we had a direct number where we could ring and we could deal with an issue straight away, and that has gone. And I just wish they would bring something like that back, because if advisors are out there in the community trying to get people pension credit, if we can't get in touch with the DWP to deal with any problems that are happening with that claim, it doesn't work. And I mean, we have people that we've put in claims for pension credit and waiting 3, 4, 5, 6 months to get the pension credit. So it's not immediate either. So they're still waiting to get that benefit once they've put it in.
I'll speed on to the next question, so thank you. Paul, you talked earlier about the working age to pension credits and actually that sort of that pre-pensionable age concern. So what can we do to ease the transition from universal credit to pension credits, and what problems would that address?
I think my comments were more around the support that people get in that period. We know, again, and it's an international phenomenon, that we have people in their 40s and beyond who are out of work for a long time. And that creates the obviously challenges in later life, because a lot of disadvantage, obviously, in later life is cumulative across the life course. And it's the intersection between age and that earlier disadvantage which creates many of the challenges in many of our neighbourhoods. There have been programmes in the past. We've piloted programmes in GM, I think in West Midlands as well, and under the last Labour government there was a New Deal for over 50s, which had mixed impact, I think it's fair to say. But we know that many of the things that the Mayor spoke about before, which is that people need spaces and places in which they can go which are trusted, and that actually it can take a long time to get people from where they are now in that age group into a position where they can work, or indeed volunteering work or some non-paid work, which I think can be hugely helpful as well. But the flip side of that is the employers, having employers which will take on older workers. We did see actually, I think towards the end of COVID, you saw people, some of the big corporates advertising for older workers and so on. And I think, again, that issue has been lost in current discussions around employment. You don't see it figuring, actually, that there are lots of people in their 50s that want to work, but need that. They need quite often specialist support. They need to talk to people who understand their lives. Quite often the digital systems that are used are not particularly useful for this group as well. And we think, we project in GM, the growth in the workforce over the next generation will be amongst older workers, and that's true nationally. And those countries and those economic systems who are able to support people to work in later life are going to be more successful than those that don't. I mean, that's the truth of it. And unless we place some prioritisation on this, our economic systems or opportunities for growth will be hindered by the fact that we have this group of middle-aged or older residents who can't find work when they want to or aren't confident to do, and so on. And again, you'll see internationally there are examples where people are trying to address this issue. There's actually very little research literature on this. There are very internationally. I think the Germans tried it after reunification with a program called Perspective 50+. In Japan and Singapore and South Korea, you're seeing attempts to do this. But it needs a whole system approach, as ever, to address this issue.
Sorry, can I just briefly come in? Just in terms of, I think there needs to be greater work around that transition from working age benefits into pension, into later life benefits. Or go back to the point that we made before, people just didn't know. There needs to be greater automation, there needs to be greater combination. The benefit system is quite difficult to navigate. Even if you're fully up on it and know what you're doing, it's difficult to navigate. You've got to apply for something to not actually get it, but then be entitled to something else. The systems need to be brought together, the teams need to be brought together, and that's across sort of government and working sort of with local areas as well. Yeah.
I think that's a perfect point to finish. Thank you so much for that. That was really useful. Thank you.
Can I thank you all so very much for coming along today and for the evidence you provide. It's been very, very important to us. So thank you.
Thank you.
And we're going to move on to our next panel in this Pensioner Poverty Inquiry session in Greater Manchester.
So the question I didn't ask is asked here and to the person themselves, so it makes more sense.
And it's lovely to welcome our Our selection to the panel from Liverpool today, and I wondered if you'd like to introduce yourselves.
Good morning. My name is Idowu Murafa. I'm the founder and one of the directors of Across Women Community Interest, based in Manchester. We work to mitigate crisis, support mental awareness within the community. Thank you.
Hello, my name's Sue Forster. I'm the Welfare Rights Coordinator at Citizens Advice Liverpool. So we're the biggest provider of advice in the Liverpool City region. And as a welfare rights advisor, I suppose I'm here because the current system just isn't working. It's not providing an adequate safety net for the poorest pensioners. It's not targeting adequate support to the poorest pensioners. So really my advice is from a welfare rights perspective about why is the system not working and how can it be changed. And what I would say is, as I say, I've been on the front line of giving welfare rights advice for over 30 years, so I still represent clients at tribunals, I still see clients every day, and we have never seen the levels of poverty that we are seeing now in recent years. Our service is now a firefighting service trying to cope with the onslaught of unprecedented demand. And we're often seeing clients who are getting the right benefits, they're getting their full entitlement, so it's not a benefits issue. We are providing anti-poverty support to people who can't eat or heat their homes.
Thank you. So we've each got some questions for you. Appreciate we're a little bit tight on time, but we are okay if you're okay to go to just before 1:45, if that's all right with you. And I'm going to ask a similar question that I asked to the first panel, in particularly, obviously, within the Liverpool region. What are the particular issues that pensioners are facing in relation to financial difficulty, and how are you supporting them?
Well, obviously what we're seeing, as I say, is a benefit system that isn't working. We're seeing increased levels of pensioner poverty, increased need for emergency and crisis support, issuing food vouchers and fuel vouchers to pensioners and all age groups, obviously. We're seeing, obviously, the widening income and health inequalities between the richest and poorest, and in Liverpool, reduced life expectancy. Since the pandemic, we are seeing reduced life expectancy in the 6th richest country in the world, and obviously there's a 10-year gap between the life expectancy rates of the poorest and the richest pensioners across the UK. So, and obviously the cost of living crisis has also compounded the problems we've seen with rising pensioner poverty. Because pensioners have exactly the same costs as everybody else, but they don't necessarily have the capacity to increase their income by working. And so, you know, the rises that we're seeing in the costs that pensioners spend most of their money on, so food, fuel, rent, and, you know, water rates, council tax, all of those price rises are putting huge pressure and driving more and more pensioners into poverty.
Yeah, I would like to share my own opinion in support of what my colleague have just said. It's really shocking sometimes when you see the pensioner coming to some of our services, and then you can see the effects of the cost of living crisis. They don't need to say it because you can read it all over them. The stress, some of them, even in terms of the hygiene as well. So, for example, the food hub that we run every Friday, we always tell them they don't need to come early, but some of them see it as an opportunity for them to interact, because some of them are widowers, that come to the services that we give for the community. The reduction in their benefits is really impacting them greatly, that they struggle to maintain basic need for themselves in terms of the food, in terms of warming up the house. It's struggle, and you can tell from their face, and when they contact us on one-to-one as well. So I always have great pity for the pensioners, especially because of the fact that they work all their life, and then for them going through struggle at this later age is really, really alarming and shocking. And I think there is need for government to step in for them to maintain and improve their dignity at this later age of their lives.
Thank you both for your time this morning. So can you tell us what is sort of unique or particular about the role your organisations can play in encouraging pensioners to take up benefits that they are entitled to?
What we do is to mitigate crisis in the family. And then what we do now is to run food hub, digital skills, and a family hub, counseling, holistic approach for the entire community, holistic approach in the sense that they can relate with their cultural background, and then counseling, therapy, food production, because of this cost of living crisis, and then support for people with substance misuse, and to maintain mental wellness, to improve health and well-being. We run cookery section for families, and then for, diverse communities to know how to use some of the food that we have, canned food. Some of them have them in their homes. They don't know how to cook it. So we run this section for them. And then we do exercise club as well, especially for sedentary lifestyle, to prevent sedentary lifestyle, and then for our senior citizens as well to come out. We've been sponsored recently by Manchester City Council, to facilitate a relationship between our senior citizens, for them to come out of their niche, to interact, to learn from other senior citizens, to interact, to learn new skills like minting, sewing, and so many other skills. So we run these different activities to help diverse community across Manchester. Yeah.
Obviously, I would agree that those services that are provided, particularly to ethnic minority communities who are facing greater levels of poverty and poor take-up, are vital. Obviously, at Citizens Advice, what we do is provide welfare benefits advice, debt advice, financial capability advice, crisis support. We now have whole teams of people who work on the Help Through Hardship national helpline, which issues food vouchers and provides benefit checks to try and address the underlying causes of why people need that emergency crisis support, as well as us having an advice on prescription service where the NHS, our clinical commissioning group, invests in our service so that every GP and healthcare professional in Liverpool can refer their patient directly to Citizens Advice for the practical advice they need and social prescribing to address issues like social isolation and loneliness. But of course, the big challenge we face with pensioners is not only poor take-up, but the complexity of the system, the unnecessary complexity of the system, and the barriers that pensioners face to claiming their correct entitlement. But also, it has to be said that our job is made more difficult in reaching those harder to reach pensioners every time the government messaging is focusing on the cost to taxpayers and the burden to taxpayers of those who are economically inactive, sick and disabled, and their carers. So the current messaging will feed into these problems of generational pride, of people not claiming what they need. We're already seeing people since the Green Paper announcement who we're telling should be entitled to PIP or should be entitled to attendance allowance who are saying they don't want to claim. So this messaging and benefits policy being written by the Treasury with the intention of making cuts rather than with the intention of improving the benefit system and providing an adequate safety net for those most in need is a huge problem, which makes our job harder, along with our perennial problem, which was obviously mentioned by the previous witnesses to the inquiry, and that's funding and resources. So at the same time as we're seeing unprecedented increases in demand, we're quite a well-resourced, advice agency with multiple projects, but in the last 6 months, we've had multiple redundancies and cuts to various projects, so cuts to our local authority funding, cuts to our advice on prescription service, and cuts to our Mind and Money Matters service, which works with the most vulnerable to provide financial capability and build resilience, and provides individualised key worker support. And our social prescribing service, we've seen cuts in all of those services and had to make redundancies. So our concern is in the current climate. Usually what we saw, for example, with the withdrawal of legal aid from welfare benefits and debt was that happened alongside the start of welfare reform and the 14 billion of cuts that have been taken out of the benefit system since 2010, 2011. Usually advice services are funding contracts at the time of most need when we're seeing policies that focus on austerity and making cuts. So that's our major concern going forward, not only about our clients and what they're suffering day to day, but how do we reach the people who need us in the current climate of funding cuts.
Thank you. And I wonder if you can tell us just a little bit about the ways in which the support your organisation provides is particularly important for our minority communities, and how is that cultural link benefiting the communities that you serve?
You meant, sorry, can you come again, please?
So I was just wondering if you could say a little more about how your organisation provides support to minority communities and how important having that cultural element to the support provided is helping people that you serve.
Thank you. Thank you very much for the question. The support that we give for the minority community is huge because we know there's a lot of barriers in terms of accessibility to all the benefits that are available for them in the community. So with the value of the fact that we have the language skills for diverse community that we serve, we have the residents have access to some of the projects and our events, and then they come to our events. They are able to have the language skills. Some of them come in terms of when they want to book appointment with their GP. The digital skill is a problem, and then, speaking as well is another issue. So they come to our services, and we're able to give that kind of interpretation for them. And not just this only, when they come to our services as well, our doors are open, not just to diverse communities only. Many comes, and then we help them to book appointment with their GP, and then sort out the issues of the pension, calling the pension scheme. So we are able to signpost them as well to other services that are available that they are not really having access to. So calling and then signposting to other BCSC and to other bodies are some of the things that we do for the community. And then we help them as well in terms of the accessibility to well-informed information for services that are available there. For example, the funding from the KEM, from Manchester City Council, so many of them, they do not have access to this. And then the complexity of the application as well is huge. So many of our pensioners cannot do this. So, but with our, with their access to our, to us, we're able to support them, and we're able to help them to fill form, to fill application for their pension, for their appointments in the hospital, and so many other things like that. So these are the things that we do for the diverse community that we support.
Thank you.
Thank you.
Thank you, Chair. So my question's directed to Sue, if that's okay. So you've touched on some of the reforms that have come through from government and some of the really valuable services that your organisation offer, like social prescribing, etc. And with those reforms will come investment. So what I hope to see is that will come through to support that holistic package, because I believe that's really the way we need to go. Now, one of the things that you've suggested, which could be part of the reform package, is a national help to claim service. So I wondered if you could tell us why you think that's needed, and also touch on how it could be delivered and funded, and what we would need to do to ensure that it's effective.
So from my point of view, I think we need to stop tinkering at the edges of these systems that don't work for the poorest pensioners. They're not delivering. The figures are shameful. We've got £1.5 billion of unclaimed pension credit and £1.1 billion of pension age housing benefit. So how much longer, how many more decades are we going to talk about the poor take-up of pension credit and pensioner benefits? What we need, as well as reform of the actual conditions of entitlement, simplification and merging of the system to make it easier to navigate, is a properly funded, trusted, expert service, help to claim service for pensioners. I mean, it makes absolutely no sense that we have that service for working age people through the Help to Claim Citizens Advice Service that offers advice on universal credit, and yet we don't have the same offer for pensioners. So the reason why I think a national Help to Claim service is so important is it would help us to address and overcome the main problems with the current system. So first of all, poor take-up. As I've said, the figures are shocking. Secondly, rise in pensioner poverty. You know, we are seeing, since 2011, we're seeing pensioner poverty rise year on year, despite the fact that expenditure on pensioner benefits is the biggest item of expenditure in the social security budget. We're spending more than ever. We're spending 55% of the social security budget on pensioners, who are 16% of the population. Expenditure on state pension dwarfs even expenditure on universal credit and benefits for working age people and children, and yet we're seeing rise in pensioner poverty. So something radical needs to be done. We're not spending the money correctly to target those most in need. So I think that, and what we have is a lack of capacity of pensioners, as Adora said, to navigate the complexity of the current system, to fill in all of these multiple forms, to make contact with the myriad of agencies who currently administer pensioner benefits. We've got the pension service, we've got local authorities administering housing benefit and council tax reduction, we've got the carers allowance unit, the attendance allowance unit, the PIP units, because there's a lot of pensioners on PIP. So the system is so complex, and pensioners don't have the capacity to fill in all of those long forms and to understand who they contact. And then we've got the problem of the proud pensioners not wanting to claim benefits. So what we think is that by providing access automatically, by building into the system, instead of leaving it up to pensioners to navigate all this and the hit and miss approach of whether they find out what they're entitled to or not, having a system which is properly funded to provide high-quality welfare benefits advice, because as was said by a local authority and housing association colleagues, it's access to welfare benefits advice that's needed first. So we have an opportunity because, of course, once legacy benefits are ended, most of the poor working age people, they'll all be on universal credit. So we have an opportunity to stop this messy transition of working age people to pensioner benefits by the DWP having the responsibility to trigger an automatic referral to the Help to Claim service for people who are approaching pension age, and then for properly trained staff to provide a holistic service, because for pensioners, it's not like universal credit. It's not about giving advice on one benefit. Pensioners need advice on all of the benefits they might be entitled to. And I'll give a quick example of that. You can have a pensioner who's struggling to pay their rent. They'll struggle and somehow manage to make a claim for housing benefit. They're disabled, they've got savings over £16,000. Housing benefits refused because they're above the upper capital limit. If they see a welfare rights advisor can tell them there's no upper capital limit for pension credit. We claim your pension credit, and then you'll get access to passported entitlement, to maximum housing benefit, maximum council tax support, your winter fuel payment, your free dental and glasses costs, access to cost of living payments, although they've gone. You know, there are lots of pensioners who missed out on those cost of living payments because they weren't on pension credit and receiving the means-tested benefits that they should have been receiving. So we have a unique opportunity to use technology to modernise the DWP computer system and then to replicate what we already know is working for working age claimants of universal credit. If I can just go on to explain how that could work, then we have the model already. Citizens Advice is already delivering a national help to claim service to working age people. And since 2019, we've delivered that service, originally via face-to-face phone and web chat channels, but from 2023-24, the DWP removed the funding for face-to-face. So the pensioner help to claim service would need to be different. It would have to provide face-to-face support rather than concentrating on telephone and web chat. It's not appropriate for the vulnerable people that we need to reach out for. But we already have the infrastructure to deliver it. We have the model and we have the infrastructure. So at the moment, we have 434 full-time advisors working in help to claim working age nationally. That funding was increased in December 2024 because to support the migration of ESA claimants to universal credit. That service is being delivered via 53 local citizens advice offices. And previously, when we gave face-to-face advice, it was delivered via 530 locations face-to-face. So not only in our network of local citizens advice officers, but also we had co-located advice offered in Jobcentre Plus settings, in GP surgeries and other community settings. So we can do it. We did it before. 60% of help to claim advice was delivered face-to-face in 2019-20. So we can replicate that, but there would be important changes to the help to claim service for pensioners to make it work for them. So as I say, an automatic referral, not the random chance that someone might hear about the pensioner help to claim service. Funding for face-to-face advice and holistic service that covers all benefits. But also, I think it's important that we would work in partnership. Citizens Advice could take the lead because we've got the national infrastructure and the experience of delivering help to claim. But we should work in partnership with the third sector organisations that work specifically with pensioners, with local authorities, housing associations, all of the other people we've heard from who are working hard. We could work jointly under that umbrella, and we could make a massive difference, I think, to changing those appalling low take-up rates and reducing pensioner poverty for those most in need.
Thank you, and that certainly echoes what we heard from the previous panel about using an age-related lens on things that already exist. So, yeah, that really does chime there. Is there anything so you've talked about changing how we do things, which I think it's clear is something we definitely need to look at. Are there any small changes in the meantime that the DWP could make that would be possible to do in a shorter time frame? So you mentioned face-to-face appointments, so would that be something you'd like to see reinstated sooner rather than later?
Yeah, for both working age and pensioners, because we're all, obviously the working age population is more digitally capable, but with the rollout of universal credit managed migration, the help to claim service has seen a huge rise in inquiries from those aged 50 to 64, and and a lot of those vulnerable ESA claimants are coming into our drop-in service as well, because they can't ring the National Help to Claim service and can't cope with making that phone call. So in local offices where we don't have the specially trained help to claim staff, we're having to pick up that problem because the face-to-face advice isn't there. But obviously there are other things that can be done. And there's one thing that should be done absolutely urgently, is that at the moment we see a significant number of pensioners, mixed-age couples, who are on universal credit, and when the youngest partner reached age 66, you would think that the DWP's flagship computer system for universal credit would automatically stop universal credit and tell those pensioners that they should claim pension credit and state pension. It doesn't. And you'll see a case study that I've highlighted in my written evidence for a client of ours who not only did she not get told that she shouldn't be on pension credit anymore, not only did she miss out on thousands of pounds of additional benefit, because of course pension credit's paid at a much higher level than working age benefits, but to add insult to injury, when she's actually underclaimed benefit, the DWP is pursuing her for a £9,500 overpayment of universal credit. We've asked for a waiver. We still haven't heard anything in response to that waiver, but that pensioner who's never been in debt has the worry of a £9,500 universal credit technical overpayment that occurred due to DWP official error. So straight away, there's absolutely no excuse why the DWP universal credit system does not stop universal credit immediately when someone reaches age 66 and tell those people, direct those people to Citizens Advice and other agencies who can help them claim pension credit and state pension.
Thank you so much, both of you. This has been really informative and will help us in when we come to write our report. But for the time being, I'm going to finish our final panel here in Greater Manchester. Order, order.